most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
They are. Title of our video is called Relaxing Pain Relief and Deep Healing in 20 Minutes. Science-based.
Right. This has got some wonderful
Got
support.
some good research behind it. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to our website, bobandbrad.com, because we're always giving something away. But today we're waiting one day. It's a Saturday, so that means the giveaway starts tomorrow on Sunday. We're switching over.
Right.
But go to the giveaway section to see what it's going to be. I can also find it on Facebook, Bob and Brad, pinned at the top of the page. You want a short version of us, go to Twitter or Instagram or TikTok. We got a 60-second version of our program.
TikTok. All right, Bob. Good. So we're talking about pain relief and healing deep. So we're talking about in the body, deep into the muscles or the joints. How do we get these tissues to heal and be comfortable at the same time?
Sure.
Well, there's options for this. And in therapy, we've been using this for years, and chiropractors as well.
Yep.
Ultrasound. Here we've got, this is a little older ultrasound, but if you haven't seen it, it looks like this, and you may work it over, and it'll get up to 4 to 6 centimeters deep.
Now, this isn't like diagnostic ultrasound that they use to tell the sex of your baby or anything like that.
Right.
This is a treatment ultrasound,
Right.
and the waves convert to heat, and it goes quite deep.
Right.
But it's a localized area. It's tough to hit a whole large back because you look at the head of this thing and it's pretty small.
Right.
So,
exactly. So it's effective, and you can't get these at home. I mean, you can buy an ultrasound at home. As a matter of fact, I'm doing a video on it next week. But they're not. They don't have the power.
Sure.
Anyways, we'll get into that another time. It's not a very good option. Diathermy has been used in the medical field, but that's outdated. It's.
I think they still do it, but I just haven't seen clinics lately.
You're not going to get one at home for sure.
No. There's a lot of contraindications to it,
right?
And it's kind of a little tricky to use those.
Yeah. So, anyways, a hot pack. Are you going to get some heat? And the heat is a key thing here, because it's been researched and it's well accepted that if you heat up the tissues in your body, there's increased circulation, vasodilation. The vessels open up so that you get more blood flow,
and more nutrients.
Newer nutrients, better healing. The lymphatic system opens up, you get more flow that way, as well as,
it cleans the waste out of your system,
basically.
Right.
Yep. Get those waste products out and get the good nutrients in. The pain threshold increases,
which means good. That means that you can do more things before the pain comes on.
Right.
And you can do more activities before the pain comes on.
Right.
So what Brad is saying here, it's deep heat is the answer here.
Right.
And so I'm going to say to you, Brad, well, how about if I just take a hot pack and throw it on?
Right. You can do that, but it's not deep.
No.
It'll go skin deep,
yeah,
maybe a little more, but it's not going to get into the muscles, not going to get into the joint.
We got to portray it on here. This is about how deep a regular hot pack goes, just like a millimeter.
Right.
Just a very small amount.
It's skin deep. There is an option you can buy at home. It's been out for a few years now. I'm not sure the exact time. It's available. It's far infrared hot packs.
Yeah.
And that's using infrared rays, or not rays, but infrared signals to get into the tissue. And it's been studied and proven that the infrared can go 2.36 inches.
And look at the difference between these two. So here is a regular hot pack. Here is infrared. If you look at that, look how much deeper that's going to go into muscle, but it also can actually go into joint.
Right.
Like if you have it on your back, right on your back, it's going to get into the joints of the back. If you have it wrapped around like your elbow, it's going to get into the joint of the elbow. Knee, it's going to get into the knee joint. Hip, it's going to get into the hip joint.
Right.
Whereas regular heat is not.
Right.
So that's where you get the healing quality of infrared, far infrared.
Right. As a matter of fact, you can buy saunas that are infrared. They heat your whole body up. I've never been in one. I haven't researched it, but I know they're available.
I know they're infrared. Yeah, correct.
Right.
My neighbor's has one, I believe.
Oh, really?
Yeah.
Maybe we should
Well,
check
to
it out.
ask them, see how it worked out.
Anyways, getting on. So they do make far infrared hot packs, and we have one right
Heating
here.
pads.
The nice thing about them is they don't get so hot as conventional
Right.
hot packs, and you don't have to worry about falling asleep with it and burning
Burning
your
yourself.
and you're burning your skin.
You can. I mean, if you put it on your like knee and left it on there
For-
for like a couple hours, it could leave a burn mark.
Right, but it's not going to be near as hot.
No, no, no.
Right.
And I think like when you have it on your back, I've had it on all night long. I do
I
every
fell
night.
asleep on mine.
Yeah.
Last night I did.
We're not going to recommend that you fall asleep,
No,
but
it's not.
I had mine on last night too, Brad, and I had it on. Well, I watched TV for an hour and a half, and a lot of times I just leave it on because these are so efficient.
Right. Yeah, I think it's 12 watts or something in that area.
A couple
So
pennies a day.
the science behind this, how do we know it goes down that deep? So they actually did a study. Dr. Ronald, I don't know if I got his name right, Reigel, I believe.
Regal or Rigel.
And this study was not done on humans, because what they did is they took sensors and actually put them into the muscle. Not many people are willing to allow
sensors put in their
put
muscles.
put sensors in their body. They did it on a horse. Okay, and they went every centimeter. They went, and it went 6 centimeters, 60 millimeters, which is 2.36 inches, and they monitored the temperature after they put.
So this is a Thermotex, by the way.
Yep.
Did we mention that?
Yep, they put the Thermotex on
Infrared.
the horse, which, by the way, they use Thermotexes on racehorses
Yes, they do.
to heal the muscles after, because they want these horses running as fast as possible. They will go to the nth degree to make their
They
bodies.
probably spend more on them than they would on
Right.
us.
So they make these that go over these horses.
Yep.
So they had one of these on the horse.
They have ones for dogs and cats too. They
Yeah,
have cat
they do.
beds and dog beds.
Let's get on
Yeah,
with the
keep going,
program
yep.
with Babbling. So they measured it, and after 20 minutes, it got up to 106 degrees, 6 centimeters deep, 60 millimeters.
Wow.
Which, by the way, therapeutic temperature range is between 104 and 114.
So it reached that therapeutic range.
Right.
It was
on the
106.
low end of it, but it got there. And I'd rather be on the low end than the high end, because
Right.
if you get to the high end, it could be dangerous or cause problems.
Right.
So this, and we know
It's
because
a
we've
great
been
option.
using these.
Yep.
They're comfortable. You don't have to worry about if you have like a sweater on, is the temperature going to get into the deep muscle? I mean, if it's going to go through the hide of a horse and the fur of a horse and go 2.36 inches, it's going to go through your sweater. You know, if you're
Yeah.
wearing some heavier clothing, you don't have to be appropriate like with a normal hot pack.
And let me just say too, if you get one from Thermotex and if you use our link, we want to make sure you guys got a discount. We get a pretty sizable. You get a pretty sizable discount when you
Right.
use our link. Plus, when you order with Bob and Brad, they give you some extra straps,
Right.
and you can strap them on your arms and actually strap it for your upper back, and the strap also helps for your low back.
Right. So it holds it to your back.
It holds at your back and actually puts you in good posture. It's a great one for like when you get knots up in here
Right.
and stuff. So we could do have some contraindications. We forgot to mention those.
That's
Brad.
right. There are some situations where you do not want to use a hot pack, whether it's infrared or a conventional.
Right.
We should go through those. If you're pregnant, you certainly don't want to put this
Over the area
your
of the fetus.
Exactly.
Yeah.
Acute inflammation. If you sprain your ankle, it's swollen up and painful. You're going to put cold on it,
Yeah.
not any heat. Probably for 2 to 3 days. When the inflammation starts coming down, then you can go back to it. If someone's confused or there's some cognition
Some
issues,
dementia or Alzheimer's,
Right.
you wouldn't want to do it on
right?
that
You,
type
you,
of
you need
person.
feedback. So I would keep it away from that population or people in the family. Open wounds or bleeding, never put heat, because it's just going to bleed more.
Yeah, yeah.
It's no good. Obviously, infection area, you're not going to use it on.
Sure.
Cardiac insufficiency. If you got any problems with your heart, you got to get permission from your doctor. And
Yeah.
you know that may or may not be a thing, but make sure you ask your doctor. You don't want to put over topical wound or
Like creams.
creams. Let's
Yeah.
say you put icy hot on or
Yeah,
something,
right.
and then put this over the top.
Oh, that's not going to be good.
Yeah,
That's
it's
going to
it's
feel
no
bad.
good.
So
So this may sound like a commercial, but it's one of those things Bob and I feel
Yeah, strongly about 'em
very
'cause,
strongly about
yeah.
it. We've used these for over 2 years now consistently. Their quality is incredible. They do what they're supposed to do. The science supports it. You'll be happy with it if it's going to
Yeah,
work
if
for
you,
you.
especially, you have chronic pain, I think this is. I actually gave one to my aunt who's got fibromyalgia.
Sure.
I just felt, and I've given a couple of these away
Yeah.
because I just felt so strongly about them.
Right.
So my
Yeah.
daughter, for she gets upset abdominal area there, she just puts it on that for cramping and stuff like that.
Oh, sure.
So,
Right.
so
Right. So very good. Great product, and if it's going to help you out, we're sure it's going to do good for you.
yeah.
So.
Thanks everybody for watching.